says it's better than Viagra, guess what? It's probably Viagra.
These lab coats are real.
Yeah, these are actually real.
These are our lab coats.
Yeah.
We didn't borrow these.
If you guys ever watched The Big Bang Theory, I got it going on right here.
You know, I mean, hell, I could fund a study right now, run it in my basement and tell you, oh, if you take this, you're going to increase protein synthesis by 500%. Oh, we got some hazardous waste here. What do you do with this hazardous waste?
Well, see, you know, any type of chromatograph or like the ICP, there's always going to be a little bit of chemical waste, so, you know, I put in the drum.
Nice. If you guys, you know, buy supplements, a lot of the supplements you guys buy online probably get their active ingredients right from here. Rest assured that if you do take any EFX or LionEdge nutrition supplements, that you will pass your drug screen.
Absolutely.
Because of this baby right here.
Hello, my name is Dr. Jeff Golini. I'm Executive Scientist at All American Pharmaceutical.
What's up, everybody? Dr. Rajoulh, CEO of LionEdge Nutrition, board certified family medicine physician. I've seen a lot of negative aspects of the supplement industry. The issue with the supplement industry is you have many people formulating these products that aren't credentialed. Do you have to be an MD or a physician to formulate a supplement? No, you do not. However, if you look at the formulators of all these supplements, you know, they're businessmen, they're, you know, former athletes, they're maybe authors, bodybuilders, which is fine. They may have a lot of knowledge in supplements, but if you look at every bottle, whether it's a multivitamin or protein, creatine, one thing that all these supplements have in common is they say consult a physician before ingesting. The reason is, you know, we have been trained since day one, since medical school, as far as what is safe. You know, what are the side effects of these taking some of these supplements? What are the ramifications of taking these ingredients? You know, some people may have underlying kidney issues, liver issues. From my experience, I've taken care of 3 young male athletes that suffered side effects from supplementation. They had no past medical history. You know, they're athletes, they were healthy, they were hydrating properly. 2 of them ended up suffering hepatitis from a supplement they were taking. 1 of them ended up getting on emergent dialysis, 23-year-old male who was taking multi-complex creatine. Now the issue is this creatine wasn't something that, you know, this athlete bought on the black market or somebody on the street. This was bought at a major retail store, maybe one that you guys drive by every day. That is the issue with these supplements. You have athletes that are potentially failing drug tests. First, you need to use ingredients that have sound research. What does that mean? A lot of these companies will make a new ingredient and they've run maybe 1 study on it with a sample size of 10 people. The issue with that is that study really has no significance. So there's something called a chi-square. The chi-square test shows you that the results did not happen by chance, that these results happen because of the effect exerted from the drug. Now, most drugs, as you know, many of you know, have to be approved by the FDA. They go through numerous meta-analysis trials, and it may take years before the drug to even get approved. The issue with the supplement industry is these companies don't need FDA approval. They don't even need to test for heavy metals. I mean, there's very minimal testing that has to be done in order for this company to produce sales. And not only that, they're using biased research that the company itself is funding. I mean, hell, I could fund a study right now, run it in my basement and tell you, oh, if you take this, you're going to increase protein synthesis by 500%. I wouldn't do that, not only because I'm lying and risking my medical license. At the end of the day, I'm going to be taking the supplements that I'm selling. I want to make sure these supplements work. I want to make sure they're effective. I want to make sure they're safe. I want to make sure you're getting your money's worth. Do you have to take supplements? No, you don't. But if you're serious about, you know, achieving positive results, you're eating correctly, you're dieting correctly, you're doing your part, you're working out, supplements do help. They help immensely. I've been supplementing for a decade. I've noticed drastic results. However, 99% of companies, this is not an exaggeration, are selling supplements that should not even be on the market. So back to my point about formulating supplements. So you want to use ingredients that have sound research. You know, an ingredient like, for example, creatine monohydrate, that has had hundreds of research studies supporting it. We know protein, whey protein is an ingredient that's had hundreds of studies supporting it. So there are ingredients that have many studies supporting it that enable a physician or somebody credentialed to sell that supplement. Now, another issue is it properly dosed, right? One of the issues with these creatine complexes, they're blending 5-6 different types of creatine, and it's a proprietary blend. What does that mean? You don't know how much of each creatine product is in that substance. You know, if you have a sore throat, you have strep throat, and I diagnose you with strep throat, I'm going to give you penicillin or amoxicillin. Unless you're allergic, we can do another antibiotic. But I'm not going to give you 6 different antibiotics. That wouldn't make sense. You're going to suffer side effects. You're probably not going to get better. And there's going to be more harm done than good. That's the same thing that these supplement companies are doing. They're blending all these random ingredients. They're marketing it as a complex. And they're trying to sell you the notion that more is better. So I feel like it's my job as a physician to educate you, to make products, and not just tell you, well, here, my product's the best. Well, I do think my product is the best because I formulated it, but at the end of the day, there are other products that are good out there. I'm not telling you, the entire supplement industry is a wash. Like I said, it's only 99% of it. So what you should do as a consumer, first you should see who formulates these supplements, who's actually making these supplements. If it's a bodybuilder or an author, an actor, probably not the best person to be formulating a substance. It's kind of a slap in the face when you have scientists like myself and Dr. Golini who've spent their entire lives studying science, knowing what ingredients are appropriate, and then we come and take care of patients in the hospital that are taking these supplements. I mean, that's very frustrating to me and to my colleagues and to the entire medical community. We're kind of fed up with all the lies that these consumers are being fed with, and not just from a point of they're wasting their money, but a lot of these patients they are getting bad side effects. A lot of these weight loss supplements, they're linked to arrhythmias, which is abnormal heartbeat, myocardial infarctions, headaches, anxiety, tremors. I mean, the list goes on. Kidney failure. I mean, it's really a serious problem. Now that we talked about formulation, a big part is also manufacturing. I've had my formula made for approximately 3 years, and it took me 3 years, guys, 3.5 years to find a dependable manufacturer. What is a dependable manufacturer? What does that mean? What does the word dependable mean? I mean, that's a very subjective term. To me, what dependable means, first, and this might sound funny to some of you, but you need to look, is this manufacturer facing a lawsuit? I can't tell you how many manufacturers I've wanted to work with that face or are currently facing a lawsuit for all the aforementioned reasons we talked about. Second is, what is the reputation of this manufacturer? Does he have a positive reputation? Third is, how does this manufacturer test? This is huge. Like, what kind of testing does this manufacturer do? Do they test for heavy metals? Are they screening the raw materials that come in? There's so much that goes into it, and Dr. Golini can go into more detail. So it took me 3 years to find that manufacturer, and that is a big part of it. You need to know where your supplements are manufactured. I'm going to be honest with you guys. I was working with a manufacturer that is in jail now that owed $50 million to the Chinese. Just imagine, I'm formulating a product how I want it, and he's giving you guys something else. So, I mean, that's half the battle is not just how you formulate your product, but who's manufacturing it. So I'm going to have Dr. Golini, CEO of EFX and All American Pharmaceutical, talk more about the manufacturing aspect and how important that is for your supplements.
Yeah, and Dr. Adam is right. It's a shame. The dietary supplement industry is actually now the #2 most regulated industry. Nuclear, supplements, then pharmaceutical. But that still doesn't keep people from cheating. And the problem with food is there really isn't a whole lot of safety being done on it, and the same thing with supplements. So supplements and food are kind of put in the same category. You can't make a claim. You can't say eating a steak, gives you more energy. No more than you can make a claim on a supplement. But like you said, there are people formulating products that have no business formulating products. Drug dealers, athletes, business guys, crooks. That doesn't mean they're not good business people. That doesn't mean they have bad ideas. It means they don't know what they're doing. And as you said, overdosing, mixing different things together. They have no idea how things are going to react on the body when you mix 2 or 3 things together. What is that going to do? What are the correct doses? Everybody, especially in America, if 1 is good, 2 is better. Yep. And right now we have a big issue with companies actually putting drugs in products. So that's why at All American Pharmaceutical we decided to make a stand that we are going to be a drug-free facility. So everything that's produced here, not only is the facility certified drug-free, but every product that runs through here is guaranteed to contain no drugs. Now, what does that mean? Maybe you're not an athlete. Well, what happens if your doctor puts you on a prescription drug and it has a counterreaction to some supplement or some drug that is in that product, you're going to have issues. Again, you are buying a nutritional supplement because you want an alternative to drugs. If you wanted to have a prescription drug, then you would go that route. So again, very, very important. So the products that are produced here are tested and tested and tested time and time again, so that at the end of the day, what it says on the label is in the bottle.
And one thing we briefly were talking about is proprietary blends. So anytime you guys read your labels, always make sure it tells you the exact milligrams of what product or what ingredient was used. Now, the reason, as many of you have already figured out, why people use proprietary blends is to save money, right? Yeah. An example is a protein blend. You know, whey isolate is a fast absorbing protein. It has the least amount of carbs, it has the most amount of BCAAs, and if you think about whey isolate, it's ultra filtered, right? So, you know, something that us frat boys used to do is we used to take 5 o'clock vodka and put it through a filter, and it tastes just like Grey Goose. Why does it taste like Grey Goose? It's taking out all the impurities. So it's an expensive process. You're basically taking a protein, a concentrate, you're taking out all the hash, all the lactose, all the impurities, anything that does not make it that lean protein that you want. And what they do is they'll make it a blend. They'll put 90% protein concentrate, they'll put fillers, and then finally there's whey isolate at the end. Now, if they're not listing, you know, the grams, you want to assume that they're not putting the proper amount. The big thing is creatine. Creatine is a prime example. A lot of people, they're doing creatine complexes where they'll have 5 different forms of creatine. Now, that should make no sense to most of you, and it should insult your intelligence. Why the hell would I put 5 ingredients of something if one has been proven to be more effective? Yeah. It's the same thing. If somebody comes in with an infection that I've identified and I've diagnosed, why would I give you 6 antibiotics? You would be pissed off if I prescribe you 6 antibiotics for your infection. You should also be pissed off if you're buying a creatine product with 7 different creatines. 6 of them you've probably never heard of, and there's probably no research, unless it's, you know, the research that the company did themselves.
Well, yeah, and you know, and I think that's the frustrating thing, as you and I as professionals, we see all the time. You see it in the medical, I see it in the supplement. A proprietary blend means fairy dusting. Exactly. And we laugh about it. I mean, like they blow a little bit in there so it's in there. But their justification is, oh, I don't want somebody duplicating my formula. Well, anything is duplicatable. You can give me any unknown and I'll tell you exactly what's in it. The reason why is they're going to put a bunch of expensive stuff on the label. Like he said, whey isolate, which is the most expensive protein. They're going to put whey concentrate and other cheap forms of protein in there, and guarantee no matter what the list is on the label, because the FDA doesn't require dietary supplements to be listed from the highest amount to the lowest amount. So they're going to tell you that there's more whey isolate when there could be pennies of it in there. So again, you got to really be careful of proprietary blends. That was the scam way of saying, I'm going to cheat you, and nothing you can do about it.
The issue with proprietary blends is not just that you don't know what you're putting in your body, but if you don't know the correct milligrams, you can really get in trouble. Here's an example. Vanadium sulfate, that increases insulin sensitivity. It's in some of these glucose partitioning agents, right? It works. The issue is it has toxic side effects, renal impairment. It can affect your vision. If you don't know how many milligrams of it you're putting in, you could be taking a toxic dose. I mean, it's common sense.
And I think, again, you know, we're talking about formulations and stuff. As I call them the used car salesman. If you're a car salesman, I'm just kind of stereotyping right now. They're not all like that. But you know what I'm talking about. The used car salesman, the slick people, they cheat. Again, you know, you can't just mix a whole lot of stuff together and say the product is better because I got more ingredients. Yeah. You know, where's the science?
Exactly.
You know, where is the right proportion of things? You wonder why you open up a lot of these bottles and they're bricks, they're hard, they're discolored. It's because they don't know what they're doing. Yeah. You know, there are proper techniques during manufacturing. It isn't a matter of putting it in a bottle and shaking it up, or just dumping it in a mixer like most manufacturers are doing, shaking up and then putting it in a bottle. Yeah. Again, you know, these are supposed to be supplemental. It isn't a replacement for food, it's a supplement. But if you drive a top fuel dragster, and I always like to relate it to cars. You would not drive up to the 7-Eleven, Town Pump, whatever your gas station is called, and put regular gas in there. Will it run? Yeah, but guess what? You're going to mess up that engine. You want to get high performance, you had better put the proper gas in. Folks, our body is a machine, you know. Yes, it can burn anything for fuel. You can eat garbage, and it will convert it to fuel, but that doesn't mean your body is going to run properly. And that doesn't mean something's not going to break down. And I think that's what you're kind of alluding to is, man, garbage in, the body's going to break down. And how, as an athlete, are you going to get the most performance out of your system without having the right type of supplements?
Absolutely, absolutely. And you never want to sacrifice results, but you also never want to sacrifice your health. So anytime me and Dr. Golini formulate a supplement, we look at three things really. First, is there research backing this? So that's number one. Number two is, will you achieve results with this? You know, we're not just going to use random ingredients, so we're not going to achieve results. Third, is it safe? You may achieve results with certain products, but is it safe? Here's an example. There's some weight loss products that had ephedra. I actually took a pre-workout that had traces of methamphetamine in it that I did not know until after the fact. But guess what, guys? I would have failed my piss test. That's the problem for some of these NCAA double athletes. They're going to fail their urine drug screen, and they have no clue. See, that's the issue. They're taking these products in order to achieve results, in order to have better athletic ability,
right?
And they're putting harmful substances in their body, and they can even potentially fail urine drug screens.
It's tough, you know, and this is a huge problem out there because there are some manufacturers that are deliberately adulterating. You see it in the protein where they're adulterating or spiking it with amino acids to get the cost down. Everybody wants their product to work closer or better than everyone else, closer to a drug. If someone says it's better than Viagra, guess what? It's probably Viagra. Folks, you can't, drugs are, billions of dollars went into researching to develop a drug, to do something. That's why they can make a claim. That's why we can't make a claim on Carbolin. I can tell you what it does, but I can't tell you this cures cancer. I can't even tell you this cures anything. No more than we can say LionEdge cures anything. So when something works as well as a drug, hey, I always say if it looks like a duck, quacks like a duck, and walks like a duck, is a duck. You know, now can we get close? Can we work from different perspectives? Absolutely. You know, we are trying to enhance performance. We are trying to prevent things from happening. The drug industry, you know, really doesn't prevent when they put you on a prescription. They're trying to fix or heal, you know, something you've already done. Now it's up to you to figure out how you're going to prevent that. And by taking something that has a drug in the product, you know, you got to make sure that the brand is reputable. You should find out where it's made. If a brand can't tell you where their product is made, what does that tell you? If you went to buy a car, a pair of pants, a shirt, shoes, don't you want to know where it's made? Yeah. I don't know about you, but I look on the label, and when it says China, I'm sorry, I try not to buy things that are made in China. Now, there are a lot of good things in China, don't get me wrong, but again, supplements is not one of the things they do well. So you need to look at where your product is made, not where it's distributed by. Second thing, they should be able to prove that it's safe. You know, be able to provide you with a certificate of analysis. As we're talking here, you know where this product is made at. You know, he's not saying he makes the product. That's not his expertise. I'm not telling you that, you know, I looked into all the drug ramifications as he did, because that's his expertise. That's why when two people like us team up and we think, we formulate, we speculate, we test, that's why we come up with the best product.
And we're not just doing this for us. I mean, to be honest with you guys, I could make a lot higher profit margins if I didn't have 20 active ingredients in one product.
It's an expensive product.
That's what a lot of these companies do. They separate out the ingredients, so they're forcing you, the consumer, to buy 10 ingredients rather than one. So we're not. This isn't like a get-rich-quick scheme. We're just sick and tired of the lies being fed to all the consumers, and that's why we're teaming up for you guys. We want to make sure that we're making the best possible products and that they're manufactured in the best possible way to achieve results and completely 100% safe. Another thing that Dr. Golini mentioned was how some of us aren't credentialed to make products. That brings me to another point. A lot of supplement companies will say, well, we make our products in-house. They're proud of it. We make our products in-house, which is fine, but that's not necessarily a good thing. If I made my products in-house, I would not want to sell them to you. I wouldn't want to take them myself. I don't know anything about, GMP, all these different, compliances that we have to do. I know of it, but I don't know the specifics. I'm not a manufacturer. So if I'm going to have my product manufactured the way I want it formulated, I'm going to go with the best. Don't always think that if a company says they manufacture it in-house, that they manufacture it themselves, that's necessarily a good thing.
Yeah.
It's really not.
And you got to be careful because most of them, they're never going to give you a peek. I always laugh at the brands that say, we manufacture in-house, but we can't show you anything, it's secret. Well, we just got done touring All-American Pharmaceutical, and there's nothing proprietary. I mean, a blender is a blender,
Well, it's hard to get a video camera crew in a basement. That's probably
why. Because a lot of people are doing it in their garages. Their warehouse, such a small facility with no quality control. And again, it's nothing wrong with having a small facility as long as you're doing it right. But again, that's why you got to be careful. If people can't show you where things are done and be upfront with you, if they say they manufacture, most of them are marketing companies. Absolutely. 9 out of 10 brands that you'll see out there that say we make their own products. There was a big brand, I'm not going to mention who they were, out of Canada. For years they were on the top, a sports brand. They had people in lab coats, chemists. I found out that
these lab coats are real.
Yeah, these are actually real.
These are our lab coats.
Yeah.
We didn't borrow these,
I found out the guy that was the chemist was actually their warehouse manager. Because he was Asian and with a pair of black horn-rimmed glasses, he looked like a doctor in a lab coat.
Oh.
It was fake, completely fake.
Yeah. Google our names, guys. Yeah. We're not hiding anything. Google the companies, and not just us. Any supplement you want to take, research the heart of it. You deserve it. Your body deserves it. We're not, these aren't shoes that you're buying. You may get a bunion on your foot, or you wear a sweater, cheaply made, you get a rash. This is something you're ingesting. This could have harmful effects on your longevity. So
well, and you said something I was just thinking about too. You get a bad shoe, you can go buy another one. What happens when you ruin your kidneys? Irreversible.
A lot of times it is.
Your body, I mean, you just don't go out to Radio Shack and buy a new liver or get a new heart. Okay, yeah, I understand you're saying, well, there's probably transplants and things. But I don't know about you, man. I want to keep the one I got. I don't want to use one, man.
I can't afford another one.
No. So again, you got to take care of your body, man. And whether it's your food, stupid things you do, your supplements, you got to be careful, man.
Oh yeah, and you can never be too careful when it comes to your body. You don't know, you don't know what a lot of these companies are putting in their products.
Yeah.
So one of the things that I did today is I toured Dr. Golini's facility here at All-American Pharmaceutical, and my mind was blown. Just the amount of research, the amount of manpower, the amount of machinery that goes into him testing. And just if you want to kind of tell us about it. Yeah.
It's crazy. As we were talking, you were saying, well, does the FDA require this? And I'm like, no.
No.
The CFR is pretty strict and stringent upon what's required. But as we're showing the ICP machines that do the heavy metals, not required. But would you want to be taking in mercury and lead? We know those are toxic and poison. Matter of fact, they'll kill you. So again, we screen every single drum. We don't randomly test. Once we approve a vendor, we take their word for it. As a matter of fact, a vendor's certificate of analysis is nothing more than a worthless piece of paper that I'm required to have. All it does is tell me what the vendor is claiming. Now I'm going to prove whether or not that's true. I'm not going to try to disprove it. I'm going to try to make sure that it is true. That's what you do in science. You always try to prove something is. Microbial, we're testing for all types of different microbes. We're doing drug screens. Okay, that is not required by the government. But we just got done talking about not only if you're an athlete, you're in the medical profession, you're a law enforcement, military, one positive drug test, you are not going to talk your way out of it and saying, oh, well, I was using a protein. It doesn't matter. Ignorance is now your fault. They say, you can't say, oh, I didn't know that was a law. They don't care.
Yeah.
So again, all these things go above and beyond. We got high performance liquid chromatography. We've got gas chromatographs with mass spectrometers. As a matter of fact, if you guys ever watched The Big Bang Theory, I got it going on right here. We got the best doctors and chemists in the world are working. As a matter of fact, I was so impressed with you, Dr. Adam, that I said, I want you on my advisory board, because I'm the first one to admit I don't know everything. You know, we specialize in our own fields. So if you go to the All-American Pharmaceutical site, look under the advisory board and check out, you know, because again, you know, I need his expertise when I'm doing formulations to get his opinion, because again, we want things to be safe. We don't want to be giving people products that they're going to have more ailments, more side effects. You know, again, people should be satisfied with what comes out of All-American Pharmaceutical, like this product.
And an issue which we talked about earlier, but I want to kind of expand on, you'll see a lot of new ingredients being put out. I feel like every week there's a new arginine ingredient. Yeah. I mean, we already know that citrulline, once it's in your bloodstream, it's basically double the effective arginine as far as the vasodilating properties. But for some reason, every week there's a new arginine product. Here's the issue with these new products. As a physician, when I treat diabetes, you know, there's insulin's the obvious one, and there's oral drugs like metformin. Those are really the only two I use. I might use, you know, glipizide, glyburide, some other drugs. I don't want to, you know, get into names, but the point I'm trying to make is there's a lot of new drugs on the market that are pushed by these pharmaceutical companies. It seems like every month there's a new diabetes drug. I do not use them. I use 0 of them. Is it because they don't work? No. They're probably effective. The issue is we find out years after the fact, oh, by the way, Jeff, I got rid of your diabetes, but you have bladder cancer, right? You guys might have heard of that drug. So a lot of these drugs, you know, years later we find out, whoa, wow, you know, these people get cirrhosis, or these people, you know, have nerve damage. So it's not worth it for you, and then even for me. I mean, at the end of the day, our names are on these bottles. Dr. Jeff's name's on his bottle. My name is on my bottle. We are formulating these ourselves. We're not going to risk our reputation and our license and all these years that we've put all this work into. When you became a PhD and a chemist, and me and MD, that's a lot of time and effort and money becoming a physician. We're not going to risk that by putting something that's a new ingredient that we find out 5 years later is going to cause breast cancer. It's not worth it to me to put you in danger by something new, just because I can put it on my tub and make it flashy and say, oh, new and improved. It's going to vasodilate your arteries by 5,000%.
And that drives me crazy. And the problem is you can't develop a new material. Because if so, you have to go through a similar process like developing a new drug. Every supplement company is looking for the edge. No science, no research. As a matter of fact, you don't even know what it is. If they tell you they got an arginine that works as good for vasodilating as some drug, again, I'm going to tell you it is spiked. I've been doing this for a long time. It is adulterated with a drug. Enough of that drug in there to get some effect. But there's no research behind. Number one, nothing to prove that taking arginine as an example and binding it to some salt that it's never been bound to, that's going to make it work better. So many of these studies now have deemed fake because they aren't peer-reviewed, they aren't published. No one has validated them. As you said, you know, I do a lot of studies in-house, but those studies are preliminary studies to find out if things work. Do I publish them or do I talk about them? Absolutely, because it's important data. But it isn't going to be definitive until it has gone through an IRB board, independent research board that first of all says it's safe for humans. Number two, no legitimate periodical will publish a study if it doesn't have an IRB number. Then the study has to be peer reviewed before it's even published. So that's how you can determine, you know, good research versus bad research.
Yeah, and anytime you guys are buying a product, if there's a ingredient that's like 6-7 Mercapto, whatever, you know, it's like 50 syllables. Google it, look it up, read about it. I don't want you taking my word, okay? I'm a physician. We have a panel of physicians formulating my products. We have 10 doctors backing up my product. Every single ingredient used in this tub is backed by research. On my website, we have over 200 studies backing up all our ingredients, right? Who else does that? I don't want you taking my word. Oh, he's a doctor, has to be good. No. At the end of the day, I want you guys to, do your part, research, read about the ingredients. You're putting these in your body. If you're truly serious about your results and you really want to, achieve a good figure, you want to improve your performance, whether it's strength or speed, agility. Just read up on it. Just Google it. You'll find it in seconds if it's legit. If it's not legit, you probably won't find it unless it's on the company's website.
And and what I'm going to add there is, folks, you work hard before you go out and just buy some product and spend your hard-earned money. If you're like I was before I got into the manufacturing, you had a closet full of products because you bought something, it didn't work. You took 2 days worth, so you went and bought something else. How many of you have a closet full of stuff that you bought, you hated the taste, it didn't work, it was nothing like what you thought? Again, as we say, don't take our word for it. But I can tell you, he spent 3 years. I spent about 6 months, working on it. So again, it wasn't something that, one day, again, we just threw it together.
Yeah.
I can guarantee that this is a quality product, that it does what it says it's going to do. And if you are looking for an edge, that's why it's called what it is, I guarantee you, this is how you're going to get the edge.
Do a full scoop. Here we go.
Oh, you going for a double scoop?
Full serving.
No. In here.
Non-proprietary dose. Everything's spelled out.
Mixed up. What was that? 4 shakes.
Yep. Oh, you got to. Old school beaker style.
That's right, man.
Organic chemistry style.
Oh, yeah, baby.
Last time I drank out of one of these, I got kicked out of chemistry class.
Oh, yeah.
Cheers.
Man. Oh, man, that's good.
I'm feeling the gains already.
That's some good stuff.
Now, when drinking this, you may experience increase in muscle mass, increase in fat loss, increase in strength. So just be aware. Exactly. And an important thing that people always ask me is, why did you just launch one product? You only have one product? Like, how are people going to take you seriously? Look, I'm not going to make 50 products just to say, hey, look at me, I'm a legit company. Because at the end of the day, I don't want to consider LionEdge a company. LionEdge Nutrition is a movement. It is a movement to make quality products, to educate the consumer, and just to help you guys achieve results. Because at the end of the day, that's what we want. This guy was a beast. They should see your pictures. I mean, this guy was a professional bodybuilder. I'm a bodybuilder, not professionally, but I do bodybuild. Yeah, we'll put a picture for you in the video. But at the end of the day, we want you guys to achieve results. So as far as why I made one product, there's a number of good pre-workouts on the market. I prefer Pre-Effects myself, and it's not just because Jess, my manufacturer. And since we're talking about that, you know what? Since we're completely transparent. Pre-workouts, I take EFX. I've taken Jim Stepani's pre-workout. It's a good pre-workout. It's all clinically dosed. Protein, EFX all the way. And I've also taken NutriBio. NutriBio makes a casein, and it's if you look at the protein per yield, it's great. Jim Stepani doesn't know who the hell I am. I don't even remember the NutriBio CEO. I think his last name's Glazier. He doesn't know who the hell I am. At the end of the day, we want to show you guys that we're completely transparent. We have nothing to hide, and just do your research, guys. That's all we ask. That's all we ask. And the reason why I only came up with one product is the most important time to take supplements is after you work out. Think about it. When you're working out, your body after is in a catabolic state. Your stress hormones are high. You're breaking down muscle tissue. You're breaking down muscle fibers. Your muscles are going through micro trauma, which could take up to days to recover, sometimes weeks. So that is by far the most important time to take supplements. That's why I only came up with a post-workout. I'll be making more products in the future, but I felt like this is something that the market needed. I felt like something was I needed.
Yeah, you're exactly right. I think people, and especially athletes, forget about the most important part of working out is recovery.
Absolutely.
Everyone spends all the time getting to the gym, getting to the game, but guess what? You're beat up the next week. You wonder why you don't make gains because you're not recovering. So again, recovery is the most important thing. You should start there and then work your way forward. So, I guess to wrap up this whole thing, we've been talking about, this product. I like to hold it because, it's beautiful.
You made it.
I did. I'm proud. And as a matter of fact, He asked me while I was in the R&D process, did you try it? Man, I try everything. You know, as an athlete, if it doesn't work for me, I would have told you.
Yeah.
You know what, this doesn't work, but it did. But man, all supplements are not created equal.
Not at all.
You want the best, you got to go to the best. You know, you don't go to a shoe salesman to help you with your headache. You want the best supplement, you come to the best formulator, and you come to the best doctor. And we aren't saying that just because we got a big head and we're proud. You know what? We know what we're doing. We've been doing it for a long time, and the proof is in the pudding. Give it a try.
And if you guys have any questions, remember, we're not here to sell you products only. We're here to educate. You don't have to buy our products in order to be educated. If you have any questions at all, feel free to email me or Dr. Jeff. You can reach out to us on our social media pages. To healthy training, guys.
Take care.
God bless.